Assalamu alaikum. End-of-life care at home during the coronavirus pandemic. Our lives and the end of our lives are in the hands of Allah subhanahu wa ta'ala. As Muslims, we are constantly reminded to reflect and prepare for death, which every single one of us will experience, and strive hard in taqwa and good deeds so that we may be reunited with our loved ones in Jannah, inshallah. The coronavirus pandemic is a means through which Allah subhanahu wa ta'ala has decreed for members of our community to return to Him. People who are frailer from older age and other health conditions are more likely to pass away. However, younger people are also getting very sick. None of us have knowledge of when our time on this earth will end. However, it is important to think and prepare for the possibility and consider what options may be available. As difficult as it might be, please have a think about whether you or your loved one would want to go into hospital should you become severely unwell from coronavirus. Especially in advanced stage and other health conditions, hospital treatments have a low chance of working, and doctors may have to make difficult decisions to reserve some treatments for people who have the best chance of improving, those who are young and usually fit and healthy. Once admitted, relatives will not be able to be with patients, even in the last days or hours of life, perhaps. Staying at home does not mean giving up. It is an acceptance of the situation and focusing on making the final days as easy and dignified as possible. Please have a think and prepare for other things that are important. It is an Islamic obligation to have a will in place. In addition, there may be other practical and emotional things to sort out, which will be very difficult to do if a person quickly deteriorates. It is therefore important to prepare beforehand. If a person wishes to spend their last days at home, this will mean that family members who live in the same house can be by his or her side. Please let your GP know beforehand that this is your preference, as they can try to carry out their own preparation and provide support if it's needed. Your GP and district nurse will also be able to get hospice support. In the final days and hours of life, a person may or may not experience different symptoms. We know that coronavirus tends to make a person feel confused or worried, or breathless in its final stages. As time goes on, a person becomes more sleepy and hard to wake up. They will not eat or drink, and these are all expected changes as the body systems start to close down. Giving antibiotics or extra oxygen may not help with these problems or cure the infection caused by the virus. Family members can do a lot to help make a person more comfortable in their last days. A calm and peaceful environment is very important. Giving reassurance, reminders of Allah's mercy and dua will also help to ease worry. Practical, helpful things can be done. This can include things such as opening a window for fresh air and sitting a person forward if they are breathless and strong enough to. Cool flannels on the forehead will help with temperatures, and using lip balm on a person's mouth to make it more comfortable. As a person gets very weak, it is natural not to eat or drink. It is important to not give food and drink which would cause a person to choke if they were not able to swallow it. As a person is in the last stages of life, breathing becomes more rapid or shallow or noisy. This, again, is a natural stage as a person passes away. Your GP can advise that certain medications are kept in the house to help with any pain, breathlessness, sickness, or confusion that might happen. We have created a separate video to explain these things in more detail. In the end, the location of where one passes is never truly in our control. But to die at home, surrounded by our loved ones and in familiar surroundings, may be seen as more of a blessing than anything else. May Allah subhanahu wa ta'ala protect us and make our return to Him full of ease and relief.